Jennifer Schultz is a pinball junkie, especially on Sundays. That's when she hauls her sidekick, 12-year-old daughter Jameson,
Nice.
to this West End Toronto pub. There in the back stands the adversary, a vintage pinball machine called Whirlwind. The irony isn't lost on Schultz. 3 years ago, the 45-year-old was caught up in her own whirlwind when she was diagnosed with stage 3 breast cancer.
I had no idea. It never had crossed my mind, breast cancer.
What followed was 8 rounds of chemotherapy, 25 cycles of radiation, and surgery. Her right breast, with an 8-centimeter-long tumor, was removed.
I'll be blue. Can I be blue?
It's an experience that Schultz shares with thousands of other women, including 48-year-old Demetra Turnbull. In 2015, she learned she had breast cancer.
I knew there was something significantly wrong. And I actually told my husband to be prepared, that I didn't think I'd live until I was 50.
Your job is to fix people.
It's the kinds of stories both women are willing to share with these medical undergrads currently on a surgical rotation at St. Michael's Hospital in Toronto.
And you're going to be telling them you're going to cut them open, you're going to cut something out, you're going to fix something in them, you might remove something. And that's a scary, scary thing for a patient to hear.
The medical students are part of a unique pilot project at the Toronto Hospital.
Be very careful with the words that you choose. And even if you've had a really rotten day, or maybe if you had the best day, you can't take it in when you're talking to patients.
Don't be too clinical, too cold, because that doesn't help the patient either, because it makes you either think something's worse, or you're just a number to OHIP.
Okay, knife, please.
The surgeon behind the mask, Dr. Jory Simpson, created the program, a first of its kind in Canada.
We should be able to get both the tumor and the node.
He says he can teach his students how to become skilled surgeons, but he wants them to think beyond the operating room to what happens after the patient is stitched up and recovering. Simpson's aim? To change some long-held myths that his own students have about surgeons.
They often view surgeons as just being the technician in the process. So if somebody presents with a breast cancer, that the surgeon just removes the tumor and then rids their hands of the patient. But that couldn't be farther from the truth.
You're a part of the team.
That's where Schultz and Turnbull take over. They are Simpson's former patients and now his recruits.
Ask those questions when you're talking to your patients. Do you have somebody at home who can help you? Hopefully, you can take a little bit with you and then give you some food for thought as you engage with your future patients.
Simpson hopes to replicate this program to other hospitals across Toronto and maybe even beyond. As for Turnbull and Schultz, they want their stories to resonate with these future doctors. It already has.
And I think just hearing these patients' stories and really just having a chance to talk to them and ask them questions and get them to teach us sort of, why we decided to go into this.
Any chance where you have, an hour to sit down with someone who's gone through an experience with a disease like cancer is always going to be beneficial, and you can't get that sometimes when you're doing your placements and your rotations.
But you can get it in the stories of survivors. Cass Rusi, CBC News, Toronto.
The Partnership Against Cancer just published a large study looking at the experiences of current and former cancer patients right across the country. Among the findings, 1 in 4 patients said they weren't satisfied with the emotional support they received during outpatient cancer care. And between 12 and 20% of patients said no one discussed different treatment options with them.